Recently, a woman in our community, a 60-year-old woman, started a medication called Ozempic or semaglutide to lose weight. She had struggled to lose weight and started the medication, and pleasantly, to her surprise, was able to lose weight. And it was very effective. She was then recommended to have an MRI scan for which she needed anesthesia because of claustrophobia. She showed up for her MRI complaining of some fullness or discomfort in her stomach. So the anesthesiologist did an ultrasound of the stomach. Although she hadn't had anything to eat for 18 hours, her stomach was still full of food. The anesthesia was canceled. And because of this example and several like it, there are some new recommendations for fasting before surgery and undergoing anesthesia that I would like to discuss. Semaglutide, or Ozempic, is an example of a GLP agonist. It's a group of medications that are used to treat diabetes and also to help patients to lose weight. They're very effective and can have some very positive benefits. One of the side effects, maybe, but also maybe mechanisms of action, is that they slow the emptying of the stomach. Patients feel full and may not want to eat as much, and that may create a situation where they lose weight as a result. Patients, however, undergoing surgery with full stomachs are at risk of aspiration pneumonia. When the patient goes to sleep, if the stomach is full, the contents can travel up the esophagus and down into the lungs, creating a dangerous medical complication. So because of the problem with emptying the stomach created by these medications, there have been some new recommendations from our anesthesiology colleagues on fasting before surgery. If you have been taking Ozempic or one of the other GLP agonists, you are not supposed to eat anything for 2 midnights before surgery. Typically, patients would be instructed not to eat anything the night before surgery, like at 11 p.m. or midnight. But the instruction is to not eat anything for 2 midnights. We had a patient recently who had surgery on Tuesday evening, and she had not had anything to eat since Sunday evening. She was appropriately following the guidelines and had been fasting essentially for 48 hours. You are allowed to have clear liquids up until a few hours before surgery. If you have been taking a GLP agonist and discontinue it, and it's been 4 weeks, the usual fasting guidelines apply, which would be nothing to eat after midnight or 8 hours before surgery, and clear liquids up to 2 hours before surgery. If surgery is urgent and you have been taking a GLP agonist like Ozempic, then you would be treated as if your stomach was full. And they have some special precautions that they can do with anesthesia to prevent aspiration pneumonia in a pinch or in a bind. So in summary, if you've been taking Ozempic or semaglutide or one of the other GLP agonists, either for weight loss or diabetes, you should be not eating anything for 2 midnights prior to your procedure to make sure that the stomach is empty so that you have a lower risk with the anesthesia.